If you see somebody who has collapsed or slumped, do you know how you can help them? Do you know what to do to save their life? Hello everyone, my name is Dr. Toluwani Rakowska-Falaye and welcome to Medication Africa, basic medical education and life-saving tips for Africans by Africans. Today, we're going to show you how to save somebody's life using basic CPR. When somebody has collapsed, we want to make sure that their heart and their lungs are still working. The heart pumps blood to every organ in the body, and the lungs fill the blood with oxygen. When the heart and lungs aren't working, it means that oxygen-rich blood won't get to the organs in the body, most importantly, the brain. The brain can only survive for about 4 to 5 minutes without oxygen-rich blood. After that, brain death occurs. When you see a person who has collapsed and isn't breathing, you can save their life by doing CPR. CPR stands for cardiopulmonary resuscitation. By doing CPR, you become the person's heart and lungs. Your actions are what send oxygen-rich blood to the brain and preserve the brain until medical professionals are able to take over. CPR saves lives, and it's not hard to do. If done immediately, CPR can double or even triple a person's chance of survival. So it's important to know how to do CPR. CPR has two parts: chest compressions, which is where you're literally pressing on the person's chest, and rescue breaths, which is where you're breathing air into the person's mouth. Chest compressions are extremely important. When you do proper chest compression, you're basically taking over the job of the person's heart. Your compressions on the chest are what is pumping blood throughout the body and to the brain. So how do you do proper chest compressions? You kneel down beside the person, or you stand up based on whether or not they're on the ground or they're on a bed. You have to find the breastbone. If you touch your chest, you'll feel this very hard bone around the center of your chest. It's a very hard bone. You can feel it. This is the breastbone. This is the area that you want to do your chest compressions at. Pause this video for a moment and try to find your breastbone. Interlock your fingers like this, and then press down on the center of the chest. You need to make sure that you're pressing down deep enough, about 5 to 6 centimeters. When you do the chest compressions, your arms need to be straight. Don't bend them. And you should compress with your whole body weight, not your arms. So your whole body is actually what should be pressing up and down on the chest. You should do about 100 to 120 chest compressions per minute. How will you know that you're doing enough chest compressions every minute? You have to use the beat of a song to help you. Common songs that people use to help them keep to the rhythm of CPR include Staying Alive by the Bee Gees, ah, 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 staying alive, or Baby Shark, do 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 do, Baby Shark do 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 do. We weren't able to think of any Afrobeat song that has 100 to 120 beats per minute, but if you're able to think of one, leave your comment below so that we can include it in our future videos. Rescue breaths. Rescue breathing is also known as mouth-to-mouth resuscitation, and here you're actually giving oxygen. You're literally breathing oxygen into the patient. How to do rescue breaths. First, you want to make sure the airways are open, and remember we do this by tilting the head back and lifting the chin. Then you pinch the patient's nose closed, and you form a tight seal over the patient's mouth with your own mouth. You breathe into the patient's mouth for 1 second, and you look at their chest. You have to make sure that the chest rises because this means that the air is really getting in there. You pull away from the patient, let the air escape, and then you do the same thing again for 1 second. So remember, CPR consists of two parts: chest compressions and rescue breaths. You should do 2 rescue breaths for every 30 chest compressions. So how CPR works is that you do 30 compressions on the chest, and then you do 2 rescue breaths. Then you do 30 compressions on the chest again, then you do 2 rescue breaths. And you continue to do this for at least 30 minutes or until emergency medical services arrive.
20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Finally, to minimize interruptions to CPR. CPR is very physically demanding. When you're doing it, you can feel very tired and you might be tempted to quit, but you do not want to interrupt CPR for any reason that is not a danger to yourself. So do your chest compressions followed by your 2 rescue breaths. Your chest compressions followed by your 2 rescue breaths for at least 30 minutes or hopefully until emergency medical services arrive. Because CPR is so physically demanding, it's better if there are 2 people doing it. So person A will do chest compressions, they will do the 30 chest compressions, and person B will do the 2 rescue breaths. And person A will then continue with 30 chest compressions, and then person B will do again 2 rescue breaths. Person A will do chest compressions for 2 minutes, and person B will give rescue breaths for 2 minutes. Then they will switch. Person B will now do chest compressions and person A will now give rescue breaths. Doing this gives each person a chance to rest before they have to do chest compressions again, because chest compressions, as I mentioned, can be very physically demanding. Okay, everybody, thank you for joining us. Hopefully we've showed you how to save somebody's life using CPR. Remember that CPR consists of 2 parts, chest compressions and rescue breathing. For chest compressions, you have to make sure that you're doing it deep enough, around 5 to 6 centimeters. Keep your arms straight. Don't bend your arms, keep them straight, and use your whole body to compress. You should do around 100 to 120 compressions per minute. Use songs to help you keep the rhythm of CPR. For rescue breathing, you should do 2 rescue breaths after 30 chest compressions. So 30 chest compressions and then 2 rescue breaths. 30 chest compressions and then 2 rescue breaths. Remember, CPR is not hard to do, and it can double or even triple someone's chance of survival if you start it immediately and you do it properly. Thank you for joining us today.